we were able to successfully get her off of all of her pain medications and use more natural ways to manage pain. So many of our patients come to mind as I think through undiagnosed patients and their stories. One example is a patient who came to me with severe, unremitting chronic pain. She'd been on opioids for a very long time to treat her severe osteoarthritis. She'd had her whole spine fused. She'd had other joint replacements, but she was miserable in severe and chronic pain. So we did our diagnostic evaluation. We did a deep dive into the gut health. We did a deep dive into what was going on with the senescence of her immune system. And where we landed on, and we thought was going to be a key factor that would help her, was to get her off her opioids. She had what we call opioid hyperalgesia, which is a condition where opioid medications, which are actually meant to help a patient with their pain, they actually have the opposite effect because they make your pain receptors more sensitive. And as soon as they wear out of your system, which keeps getting shorter and shorter, that time span, the pain gets much worse. We were able to successfully get her off of all of her pain medications and use more natural ways to manage pain through things like vagus nerve stimulation, things like ketamine therapy, etc., and achieve great results in that case. So that was a memorable case that I would like to share with you. A gentleman who had inflammatory arthritis for many years came to my clinic, and he had tried all kinds of biological therapies to help his ankylosing spondylitis diagnosis. However, they were no longer working. What we did was do a real root cause analysis, and we found all of these gut issues that he had been suffering from for many years. In fact, he had an overgrowth of a particular bacteria in a small bowel that we diagnosed using our advanced diagnostic capabilities, which then allowed us to tailor our therapy for this patient and then get much better outcomes than using the biologic therapies alone. A young girl came to my clinic because she was just so exhausted with minimal exercise. And this was very concerning because she'd been an athlete most of her life. And once she hit the age of 21, she got into college, she had mononucleosis, everything went to hell. She no longer could exercise, she started gaining weight, she had severe fatigue, mental fogginess. And we did a very thorough diagnostic evaluation for her and found that the Epstein-Barr virus was hard for her own immune system to control. She had a lot of problems in her gut that were contributing. She was hypermobile, and we diagnosed her with Ehlers-Danlos syndrome, which was also contributing. She had what we call mast cell activation syndrome. So employing all of the techniques that we have, including both natural, holistic techniques, lifestyle medicine, and pharmacologicals directed at each of these domains that we had discovered through careful history diagnostic evaluation, we were then able to help her gain back her life. But the real kicker in her case was understanding her autonomic nervous system and using the autonomic nervous system to get all the other systems into alignment and working well together with each other. And that really was a game changer for her. And she's a happy camper now and doing better, starting to hike and starting to do all the things that she enjoyed.